Fitness to fly. Cardiovascular. So after a PCI, which has 3 letters, you're allowed to fly after 3 days. After an MI, you're allowed to fly after 7 days, unless it's complicated, in which case you're allowed to fly after 4 to 6 weeks. If you've had a cabbage, you can fly after 10 to 14 days. So after the 3 letters of PCI, add 4 to get to MI and 4 to get to cabbage, there or thereabouts. There are some conditions which prevent you from flying, regardless of how well you think you're doing. Uncontrolled arrhythmia, uncontrolled hypertension, although there's no official blood pressure threshold as to what's uncontrolled, unstable angina. If you've had a pacemaker or an internal defibrillator, you're fine to fly. Respiratory. So if they're asthmatic, tell them to keep their inhalers with them. If it's COPD, they might need supplemental oxygen. And for bronchiectasis and cystic fibrosis, antibiotics and mucolytics. If you've had the flu, you have to postpone the flight. Pneumonia prevents you from flying unless you've clinically improved, there's no residual infection, and you have a satisfactory exercise tolerance test. After a pneumothorax, you can fly after 2 weeks from successful aspiration and full lung expansion. So 2 lungs, 2 weeks. If you really need to travel, you can, as long as you have a Heimlich valve attached to the chest drain to prevent a tension pneumothorax. Neurology. After a stroke, you can fly after 10 days, but if they're stable, you can fly after 3 days. Obstetrics. If you're pregnant over 36 weeks, you're not allowed to fly. If you have twins, you're not allowed to fly after 32 weeks gestation. Hematology. Sickle cell anemia. You may need supplemental oxygen. And sickle cell crisis. You can fly after 10 days.